Today, the Supreme Court made it even harder for patients on Medicaid to access health care from Planned Parenthood. Just to be clear, it was already illegal for Medicaid to pay Planned Parenthood, or for that matter, any other provider, for abortions, except in very, very limited circumstances: rape, incest, life of the mother. The court's 6-3 ruling allows South Carolina to stop patients who rely on the government insurance program from using Planned Parenthood for any health services. South Carolinians who relied on the clinic for things like cancer screenings, birth control, or LGBTQ patient support, all totally unrelated to abortion, can no longer use their usual provider. The case stems from South Carolina's decision in 2018 to kick Planned Parenthood out of its Medicaid program. That was a decision that the state's Republican governor, Henry McMaster, made to, quote, protect the sanctity of life, unquote. But after this Supreme Court ruling, any other state that wants to block funding for Planned Parenthood simply because it also offers abortion services that don't use taxpayer funds will be able to do that. So now the poorest Americans could lose the right to get routine health care from the provider of their choice. Joining me now is Alexis McGill-Johnson. She is the president and CEO of the Planned Parenthood Action Fund. Alexis, thanks so much for joining us. So my first question for you is, what services are at stake here?
What you just named: birth control, STI testing and treatment, access to wellness exams, cancer screening. As you named, Medicaid was not paying for abortion services, and yet Governor McMaster made it clear that his entire agenda was about denying access to, patients using Medicaid at Planned Parenthoods because he had an ideological agenda and because he had the power to weaponize Medicaid. And the Supreme Court agreed with him, and they effectively decided that state officials can pick your health care provider for you based on what their ideological agenda is. And it's absolutely horrific and unconscionable.
What does all of this mean for Planned Parenthood as an organization in itself?
As I said, this is not a decision that is going to be limited to Planned Parenthood, nor is it a decision that is going to be limited to South Carolina. What the Supreme Court has done is effectively denied people their dignity to decide who their provider is going to be. And they've also denied the justice for patients to be able to sue to determine who their provider is going to be. And so we expect to see a number of states that also share the same ideological agenda as Governor McMaster in South Carolina try to, kick Planned Parenthood out of being able to get reimbursed for the services that they provide, like any other healthcare provider across the states that also have a strong bias against abortion as healthcare, and that is going to impact so many people, millions of people living in all these states.
I want to talk a little bit more about what happens to the patients themselves who might lose access to care at Planned Parenthood or other clinics that are affected by this court decision. One of the largest crisis pregnancy center groups, which are these places that persuade women who are pregnant not to have abortions, they're now telling their member clinics to avoid performing prenatal ultrasounds on women who they suspect have ectopic pregnancies. That's according to recordings obtained by NBC News. So if the local Planned Parenthood in an area is forced to shut down, what kind of quality of care will patients end up with, whether they end up at a crisis pregnancy center or whatever other options are available?
Well, look, we actually have data and history on what happens when health centers shut down, right? During COVID, when, obviously people had limited access to getting care in clinic, we saw a spike in STIs, including chlamydia, which has a direct relationship to, left untreated, to ectopic pregnancies. And the impact of, obviously having an ectopic pregnancy and not having that treated means incredible danger to the life of the person who is pregnant with that potential ectopic pregnancy, both for the life of the parent as well as the embryo. That is something that we will see over and over again when you see the impact of these centers closing. And so I think it's really important for us to remember in this moment that the Supreme Court has made this decision to limit access now to Planned Parenthood for patients who have used Medicaid as their insurance. We also have Congress that is working its way through a congressional defund of Planned Parenthood that could impact 1 million patients, that could impact 200 health centers that are at risk of closure. And when you, again, close health centers in communities, that may be the first point of entry for many people into the healthcare system, it means that we are at greater risk for seeing the kinds of increases in everything from, missing access to birth control, to getting the STI treatment and care that they need. And for the centers that may be at risk of closure, many of them are in states that actually still provide abortion access. So we're going to see, with this defund around Medicaid and this defund around Planned Parenthood, really an increase in the public health crisis that we are already experiencing.